Good morning, everyone. My name is Maya Luria with TMC for Seniors. And today we have a great topic about communication strategies and how you care for a loved one with dementia. I have Amanda Cooper here with me today. She is a master's student with the Department of Communications and a doctoral candidate at the University of Arizona. Her research interest is in the intersection of interpersonal family and health communications. That's a lot to say. Specifically, she's interested in the way individuals and families utilize communications to negotiate experiences related to aging, such as retirement, illness, role reversal, or end of life planning. Today, she's going to be discussing her research on how to communicate with a loved one who has dementia. Welcome, Amanda. I'm so glad you're here with us today.
Thank you. Thank you for having me.
So I'm going to go ahead and put your slides up for you so that you can go ahead and get started. And we do have an online audience along with an in-person audience. So if you have questions for Amanda, please put them into the chat for us, and then I will ask those. I'll ask Amanda those questions afterwards. So go ahead and start, Amanda.
Okay, thank you so much. Welcome to our online audience and our in-person audience. I'm excited to be with you. I'm going to try to be on the screen, but also not behind the screen, so we can do both. So today, I want to share a little bit about some of the research that has been done about communication strategies for communicating with a family member or a loved one who has Alzheimer's disease. And then I'm also going to share some of the research that I've conducted about some of the changes that happen in marital relationships with Alzheimer's disease and the communication that caregiving spouses can use to help maintain a connection and closeness with their spouse who has dementia or Alzheimer's. So let me get started. First, here's kind of a preview of where we're going. First, we'll talk about communication recommendations. So these are more general recommendations that I'm pulling from academic research about communication. Then we'll talk a little bit about those relationship changes in the work that I've done in marital relationships and specific communication strategies that couples use to maintain their relationships. So that's kind of going to be the overview of what we're going to do today. So first, let's start by talking about these recommendations for communicating with a family member who has dementia. And before I jump in, I just want to make a few disclaimers. The first one I want to say is that I know that dementia can be a really challenging disease to deal with. So if you're dealing with this in your family, or if this is something that you're experiencing in your own relationships, and you want to step out at some point, or you just need to take a break, that's totally fine. Please feel free to do that. Also, another kind of disclaimer here is I personally have not been the spouse to someone who has dementia. I have some grandparents who have had dementia, but I might not be as close to dementia as some of you might be. So my research is pulling from the lived experiences of individuals and input from individuals who have had these experiences, but I personally haven't lived with this experience as closely. So I'm really excited to hear what insights you might have, what experiences you've had, and answer any questions you might have about the research that's being done in this area. But I think it's always good to be clear about kind of where my position is coming into it, so that you kind of know where I'm approaching this from, and kind of where I'm standing. So that's my big disclaimer to get started. So now let's jump in by talking about some of these communication recommendations. I'm drawing from the DemTech. I think it's called the DemTech Strategies literature. So this is some work that was done in the UK by Dr. Tony Young and his collaborators. And what they did to develop these recommendations was they sat down with people who have dementia, their family members and loved ones, and professional care providers, and talked about what is important when communicating with someone who has dementia, what communication strategies or approaches are most effective. And then they created this DemTech guide that kind of lays it out. So I'm going to be drawing from some of their work for the beginning of this presentation. And this like set of strategies builds on 3 levels. So the first level is beliefs and principles about communication with individuals who have dementia. So usually this is grounded, this is sort of like, what are the grounding principles or beliefs we need to have in place to help facilitate positive communication and interactions with these individuals? So some of those beliefs are, valuing communication, valuing the individual, acknowledging their personhood, and working to empower them to engage in conversation. So this is kind of the groundwork, is just what are your beliefs about communication. The second level of their set of recommendations are these 8 components of good communication practice. So these include conversation, body language, environmental considerations, anxiety reduction, mindfulness and empathy, understanding behaviors, retaining a sense of self, and checking understanding. I'm going to highlight 2 of these in depth today, the conversation piece and the body language, but I'm going to try to integrate some of the other recommendations they make with these other 8 components as I talk about those. And then the last level in this recommendation packet that they have is actual communication between individuals who have dementia and their family members. And so for this last piece, what I'm going to cover is some of the research I've actually done based here at the University of Arizona. So let's get started first by talking about, what is this level 1? What are the beliefs and values that we need to have in place to help facilitate successful communication with individuals who have dementia? So these are the guiding principles and beliefs. And the first one is a belief that communication is a basic human right. Communication enables individuals and families to shape meaning, to facilitate their relationships and connection with one another. Oh yeah, here comes someone else. Hello, come on in. So this is sort of a grounding principle we need to have in place, that in general, communication is important for individuals. That's sort of a baseline framework belief. The second one is an understanding that dementia can make communication more challenging for a couple of reasons. The first is that some of the symptoms of dementia actually impact communication ability. So dementia can make it more difficult for the individual to follow a conversation. Dementia can make it more difficult for them to remember things, to be able to add to the conversation. And it can also make it difficult sometimes, depending on the type of dementia, for them to produce the specific messages or language that they're trying to say. So sometimes dementia can make it hard for individuals to get their words out. So that's one reason why dementia might make it a little bit more challenging, and why we need to be more mindful when we're engaging in conversation with someone who has dementia. The second reason is that there's also some stigma attached to dementia in our society. So individuals who have dementia sometimes feel embarrassed or shameful. They might feel like they have some stigma because of the disease that they have. So when we're communicating with someone who has dementia, we want to be mindful of these 2 things that can make it more challenging for them to engage. We want to make them feel comfortable and accepted and valued, and also be aware of some of the challenges that they might have so we can accommodate those challenges. And then the final guiding belief or principle is that people with dementia can maintain a sense of self and control of their own lives as far as their circumstances permit. And that in tandem with that support from family members and friends and other people can help them maintain the sense of self and help them retain a sense of agency. So these core principles or guiding ideas are that, first of all, communication is really important for us as human beings, and especially in facilitating relationships. An awareness of some of the challenges that dementia can create in engaging in conversation and communication, and a belief that the person with dementia has the ability to engage, and that we can continue to engage with them and help support their agency and their personhood throughout the disease. So these are kind of these grounding principles that are setting us up to then look at some specific components of good communication practice. So like I said, I'm just going to highlight 2 of these, but I'll try to touch on some of those other components. If you're interested in this DemTech work, it's really excellent. They have really good recommendations and also examples of how to engage. I have some literature on that. So if you're interested, reach out to me at the end. I'd love to share more of their work with you. It is really excellent work. So the first one of these 2 components of good communication practice is conversation that we're going to talk about. So they use this line in the DemTech packet, and I love this. Communication is caring. This kind of goes back to this idea that communication is a basic human right. Being able to engage in a conversation with someone is one way to show that you care about them, one way to show that they are still valued and connected. So I like that idea of conversation is caring. Being willing to engage in conversation is caring. So here's some specific tips or ideas that might be helpful in facilitating this type of conversation. One of the first things is starting the conversation. They recommend that when you're starting a conversation with a person with dementia, making sure that you get their attention in a good way. So touching their hand or arm to get their attention. If you think the person might not recognize you, so we're thinking about some of these later stages of dementia, introducing yourself so that they know who you are. I know that sounds kind of funny in a family relationship, but as the person with dementia progresses in their disease, if they get to the point where they're not recognizing people, not taking it for granted that they should remember who you are is helpful. Introducing yourself, kind of setting up the conversation in a way so that they know who you are can be really helpful. The second is to minimize environmental distraction. Now, this gets to this idea of environmental considerations, which is one of their other things to consider in good communication practice. And this is really important for individuals who have dementia, because one of the things that dementia does is it often makes it difficult for them to sort out background noise from the thing they're trying to pay attention to. So if you're in a really noisy room, it's going to be really challenging for the person with dementia to hone in on what you're trying to say, because they have all this other input that's coming into them. So this idea of kind of minimizing these background distractions or thinking about the environment that you're in is really about how can you set up the environment so that the person can focus in on the conversation. So turning off the TV, turning off the radio, going into a quiet space. So if you're in a really loud cafeteria or if you're in a space with a lot of other people, finding a more quiet place is going to facilitate better conversations, and it's going to help you be able to have a more effective conversation. So that's the second recommendation. They also recommend recognizing, again, some of the challenges that dementia might cause for their ability to engage in conversation, and just being patient and letting the conversation flow more slowly. So I'm a fast talker. I like to buzz through conversation. But when we're communicating with someone who has dementia, allowing the pace of the conversation to slow can be valuable. Giving them more time to respond, to think through their response, and just being patient with letting the conversation flow can be helpful and important. Another recommendation they have is to expand beyond sort of like boring topics, like the everyday things like the weather or just like instrumental care. So don't just talk about eating lunch or what are you going to wear or what should we do right now. This goes back to this idea that conversation is caring. A good conversation is a way that we can show someone that we care about them. And part of a good conversation is having somewhat of a variety of topics. So when you're communicating with someone with dementia, you probably know where your family member is at. You probably know the kind of conversations they can engage in. But being willing to let that conversation expand beyond, whatever is right at hand can be a good way to, again, kind of show that person that they're valued and engage in a richer conversation. Another recommendation is to use pictures or objects to help the person recall and follow the conversation. So that could be something like a photo album, or that could be something that might trigger some memories for them. That could also be, if you're trying to help do something that is a little bit more instrumental, pointing things out or holding things up to make it clear what thing you're referring to. Using these sort of, I'll call them visual aids, can be really helpful in helping the person who has dementia follow the conversation, as well as recall things to be able to engage in more of a conversation. There's some great research on the use of photos and memorabilia to kind of help spur conversation with people who have dementia. Another recommendation that they make is that if the person says something that you don't think is correct, or isn't correct, or if it's a little bit confusing, giving them space to talk about that thing and then asking questions rather than just correcting them. So again, we're thinking about trying to promote conversation. Sometimes that means going with that person wherever they're at. So asking some questions rather than correcting, and kind of following with whatever train they're on. Maybe as you listen, you'll be guided to know how you can kind of shift the conversation back if needed.
Can you give an example of that, please?
Yeah, so something that happens in dementia often is people will sometimes have like hallucinations or they'll get confused. When my grandfather had dementia, he would often think that people were other people than they were, and then he'd talk about that person. So like he thought that my aunt was his cousin, and he thought that another aunt was his sister, right? So he had some confusion about who people were. And different family members had different strategies for dealing with this. So my dad would kind of say, no, that's not that person. He would always be correcting him. But I think in line with these recommendations, a better strategy might be able to say, well, tell me about that person. Like, oh, like, well, what is, what did Sharon do? Or how are you connected to Sharon? Like, let's talk about her. So allowing them to talk about where they're at and maybe having a conversation in the space where they are rather than immediately correcting and moving them back into the solid present. Another thing could be if they're confused. Often you might not understand what they're experiencing fully. So just asking questions like, well, what are you thinking? Or what do what's going to happen? Why do you think that? Like asking some questions to kind of better understand where they're at. That allows more space for them to be able to engage in that conversation. It can also be important. One of the other tips we're not going to talk about as much is understanding behavior. If you can kind of ask questions and probe to understand what they're thinking, what they're experiencing, that can help you better understand maybe some of their behaviors as well. So particularly later on in some of the later stages of like Alzheimer's or later stages of dementia, there can be some agitation with people who have dementia sometimes, or you might not always be able to tell what is frustrating them or upsetting them. Being able to, again, stop and ask some questions, maybe can help you kind of understand what might be causing some of that. So it's about, again, slowing down in our conversations, paying attention and probing and listening. Did that answer your question?
Yes, it did.
Okay. So kind of related to this is this idea of listening closely and checking for understanding. So when you're having a conversation with someone with dementia, particularly if they are a little bit confused or maybe you're talking about things that you don't think are quite right, listening carefully, paying attention to what they're saying can cue you into where they're at and maybe help you understand some of their behaviors or some of their emotions that I think sometimes can be challenging for family caregivers. And then checking for understanding is both checking to see if they understand, also checking to see if you understand. So asking questions again can be a helpful part of that, helping you understand where the person is at so that you can kind of facilitate a better conversation. And then the last one is a good tip for all communication: be patient and have a sense of humor. I think, again, in my own family experiences, I had some family members who are kind of like, you need to be correct. We need to be in reality. And I don't think that was very helpful for facilitating good conversation or really facilitating good relationships with the loved one, the family member who had dementia. So the more that we can be patient, easygoing in our conversations and have a sense of humor, that's going to facilitate this ability to have conversation. Okay, so the second recommendation I want to kind of zoom in on is nonverbal communication. So nonverbal communication is also called body language. And it includes essentially everything that is not the language. So everything that is not the specific language that we are speaking or the words. So it is facial expressions, touch, physical touch of any kind, eye movement and eye contact, tone of voice, pitch, gesture, and posture. So it's almost everything that you can observe if you didn't understand the language would be counted in body language or this nonverbal communication. And nonverbal communication is really important when we're having conversations with our family members who have dementia, because generally nonverbal communication stays intact longer than verbal communication. So the person with dementia might still be able to understand your nonverbal cues, and they might still be able to communicate nonverbally even after they've lost some of their verbal communication skills. So that's important. Another thing that just makes nonverbal communication in general important is that communication scholars some scholars suggest that we actually get more information from the nonverbal cues than we do from the verbal spoken language when we're having a conversation. So just in general, nonverbal communication is pretty important. So I'm going to point out some of their recommendations for how we can pay attention to these nonverbal body language type of expressions to kind of help facilitate communication with our loved ones who have dementia. The first one is just thinking about touch as a way to communicate. So again, like a gentle touch on the arm or hand, holding someone's hand, giving them a little hug. Obviously, touch differs by person and by relationship and culture, but for your family member, you probably know how much they like to be touched. Often just a small grab on the hand or a touch on the arm can be a really helpful thing in helping calm down the person who you're talking to. One of the other recommendations focuses on managing anxiety. Again, I talked about sometimes people with dementia can kind of be upset for reasons you don't always know. When we're trying to have good communication with our family members who have dementia, gentle touch can be something that can kind of help manage that anxiety, help calm them down, and help them get in a place where they feel comfortable engaging in communication. As much as possible, when you're having a conversation with someone who has dementia, try to maintain eye contact. So we know that eye contact is important in all communication. Your mom might have told you that, like, look people in the eye when you're talking to them. That's something that we value as people, is just eye contact, but particularly in dementia care, connecting with someone through the eyes can be one of the best ways to make connection with the family member who has dementia. So when you're sitting down and talking to someone, not be like looking at your phone and talking, or turned away doing something at the stove and talking. If you want to have good communication with your loved one who has dementia, looking them in the face and making eye contact is going to be helpful. And related to that is this idea of getting on the same level as the person that you're talking to. This is particularly relevant if they're in a wheelchair or if they're sitting often. So rather than just standing over them and talking to them, making an effort to get on the same level. So sitting down together to talk rather than standing over and talking. This kind of gets back to this idea of conversation as caring. One of the ways we can show that we care is kind of putting ourselves on the same level as the person that we're talking to. So that can be another thing that sort of facilitates or helps conversation and communication. Another one, which I've been violating greatly this morning, is to avoid unnecessary hand movements. So I've been gesturing all over the place. I am a big gesturer while I talk. I like to use my hands. But when we're communicating with a family member who has dementia, too many gestures, like this, which I've been doing all morning, too many gestures can be distracting. So it goes back to this idea of environmental considerations and this idea that people with dementia sometimes have a harder time focusing and blocking out other stimulus in their environment. So if you're using your hands a lot, like I do, that can be another source of distraction that might distract them from the message that you're trying to actually communicate to them. So being mindful of how you're moving your body while you're communicating can be really helpful too. Another thing is just using a kind, reassuring tone and smiling. So again, we're getting back to the very basics of nonverbal communication. Think about what your tone is like when you talk to your family member who has dementia. Is it encouraging? Is it warm? Or are you getting a little frustrated? And is it a little bit harsh? They can read your tone. Even in some of the much later stages of dementia, those nonverbal cues are still readily available. And then, of course, smiling, being aware of kind of what your face is saying as well. Okay, so that is the end of our recommendations. Again, if you have more questions or you want more information about these recommendations about good communication practice, I'd love to share those with you. But now for this last part, the actual communication between individuals with dementia and their family members, we're going to move into some research that I conducted. This was actually part of my master's thesis here at the University of Arizona. And it focused on relationship changes in marriages impacted by dementia and the communication strategies that help kind of facilitate ongoing connection in those relationships. So for this study, what I did, well, actually, let's go here. I'll give you my driving research questions. As a researcher, this is really important, so I couldn't help putting it in. So the two questions I wanted to answer with this study were, one, how do marital relationships change over the course of dementia? So we know that dementia generally lasts a pretty long time. And so I wanted to know what happens in marriages that are impacted by dementia. And then the second question I had was, what communication strategies help couples maintain connection over the course of the disease? So that was sort of where I was motivated. And what I did for this study was I did in-depth interviews with caregiving spouses to a person who has dementia. So I sat down and I talked to people whose spouses had dementia, and we talked about their relationships and about their communication. And something I used to help that was these timelines. So before we had the interview, I had them make a timeline of turning points that happened in their relationship. Now, a turning point is a specific event that shifts the nature of the relationship in some way. So if you think about relationships you have, maybe I don't know how many of you are married or partnered, but maybe if you think back across the course of your relationship, you can think about some of these moments that would have changed the nature of your relationship. So often if we think about dating relationships, it's things like the first date. That might have been a thing that changed the nature of the relationship. And then maybe like the first time you said, I love you, that might have been a moment that changed the nature of your relationship. When you decided to be exclusive, right? You're kind of seeing these specific moments that kind of change the relationship. So what I wanted to do is I asked these caregiving spouses to think about their relationships from the earliest onset of dementia symptoms to their present and map out events or changes, things that changed their relationships in some way. So I had them map them out on this timeline, and I had them put the things that made them feel closer to their spouse above the line, and the things that made them feel more distant or strained below this line. And then once they had created their little timelines, we sat down together and we talked about each of the experiences they put on their timeline and the communication that they engaged in around those events. So this is sort of how the study unfolded. And I'm going to show you kind of an overwhelming slide. I'm giving you a warning now. We're going to break it down, I promise. But this is sort of the broad summary of what I found through these timelines and through these interviews with caregiving spouses. So these are all the turning points. They're marked with the circles. And then 4 broad relationship changes that were kind of created by these turning points. So let me dig in. And now this is where those little handouts are going to come in handy. So who didn't get a handout? I think 2 of you in the back. Is that right? Would you just hand out the blue ones? Yeah, perfect. Okay. So there are, so I'm going to briefly talk about these 4 turning points. But if you have one of the handouts that I gave, they kind of show you the 3 of the 4 relationship changes. And they have some quotes from participants that give you kind of an idea of what this looked like for the individuals. So if you want to be reading the quotes, you're welcome to do that. Those are kind of an overview of what we're going to cover here. So the first relationship change that people experienced was just the realization that their spouse had dementia. This was a change for a lot of people in their relationship. And this was started by first awareness of symptoms. Often there was some kind of really memorable event that they realized like something is going on here. Like there's a change in the relationship because they were noticing these early symptoms. And then the second turning point was for many of them receiving a diagnosis. And the early symptoms were often usually pretty confusing for the spouses I talked to. They didn't fully understand why their spouse was changing their behavior. And so when they received the diagnosis, this was actually really helpful for them because it kind of helped clarify what was going on. So these are the first 2 turning points and the first relationship change. The second relationship change that a lot of these spouses to a person with dementia talked about was this idea of the nature of their relationship shifting from being spouses to being more of a caregiver. And this happened through 4 different turning points. The first one was when their spouse lost their driving privileges. And a lot of these caregiving spouses talked about having to have a conversation with their loved one or with their spouse about not driving anymore, and how this was a really difficult turning point because it was the first time they had to start kind of monitoring or controlling their spouse's behavior in some way. So a lot of the caregiving spouses I talked to said things like, I had to take away the keys, or I had to, right? They kind of talked about the way that they were starting to monitor their spouse's driving behavior. So this created a change. Another thing that changed the relationship was changing household roles and responsibilities as their spouse began to not be able to do all the things they used to do. So maybe they weren't able to cook anymore. So that was something the spouse started doing, or they weren't able to mow the lawn anymore. So that was something the spouse started doing. And these changes kind of shifted the relationship as well. Some of them talked about feeling less romantic as they took on more of these household responsibilities and changes, and that kind of shifted the relationship. And then just as the symptoms began to intensify, so these more severe symptoms also kind of made them feel more like they were caregivers than spouses. And then the third relationship change was this idea of my spouse is gone. Now, this is sort of, a lot of these caregiving spouses talked about this sense that their spouse was different than they had been before. So the person who they had been before had changed in some way. And the things that kind of led to this sense or this change in their relationships was losing intimate conversations. So this goes back to conversation. When they felt like they weren't able to engage in conversation in the way they had in the past, they felt like that was a change in their relationship. Another one was altering living arrangements. So they talked about maybe having to move into separate rooms because of care, or moving their loved one into memory care. These were things that they also felt changed the relationship and made them feel like their spouse was gone in some ways. And then the last one, and not as many of my participants experienced this, but some of the caregiving spouses I talked to had a moment where their spouse could not remember their name anymore. And for them, that was a really obviously devastating, challenging change that kind of solidified this change in the relationship. So those first three changes are all really difficult. For this study, I found there's a lot of really challenging things that happen in these relationships. But the last piece is quite positive. So this is transcending dementia through love. This is the green part up at the top. And what I found was that unlike these other ones that were kind of related to specific turning point events, this idea of transcending dementia through love occurred across the disease trajectory. The spouses I talked to, they talked about the ways that they actually felt more love for their partner because of the experiencing dementia together. So let me give you some examples of what this looked like. Tom, who's one of my participants, said, "I have felt more married and more in love with her than I did before the diagnosis. When something like this happens, it can be an agglomerator. It can be a glue." And so this relationship change, rather than being really challenging, actually a lot of these caregiving spouses talked about the ways that providing care to their spouse made them feel closer, or made them feel like they loved each other more. Here's another one. Annie said, "In one sense, Alzheimer's has drawn us closer, not in a romantic way. It's just drawn us closer to be more friends and more caring. We are true friends and soulmates." So although they were experiencing really difficult changes and challenges in their relationships, almost all of these spouses also talked about ways that they experienced this positive change of feeling closer to their spouse. A lot of them also talked about the ways that providing care helped them feel closer. So Carol said, "Caring for him gives me satisfaction. It's loving him." So being able to kind of be in the role of caregiver actually was also a way for them to experience greater love for their spouse. And what I found was a lot of this ability to feel greater love or connection came through communication. So that leads me to talking about what are some of the communication things that were going on in these relationships that helped them feel closer to their spouse. So first I'm going to talk about some of the things that their spouse did, the person who had dementia, and then I'll talk about some of the strategies that caregiving spouses used. So for the individuals who had dementia, one of the first things that they talked about was their spouse accepting the diagnosis. Now, this isn't specifically a really specific communication technique, but their spouse's ability to say, "Yes, I have dementia," or "Yes, I have Alzheimer's disease," that acceptance that they had dementia was really important for facilitating their ability to provide care and helping them maintain a more positive environment in their marriages or in their relationships. The second one was expressing affection. And this was done across the disease trajectory in quite a few different ways. So here's an example. Appreciation is what that says. Expressing appreciation. Jennifer said, talking of her husband, "He tells me every night whenever I cook, 'Thank you so much.' He appreciates those things that he probably wouldn't have before." So when their spouses were appreciative of the care they were giving, that was really helpful. Another thing was anytime that their spouse could remember or recognize them. So moments or instances of remembering and recognition were really important. So Garth, whose spouse was pretty far along in the disease, he said, "She looks up with a big smile on her face because here I am. And that's a great feeling to see her like that she knows who I am." So even just that recognition that the spouse remembered things or they recognized them, that was something that was helpful in helping them maintain that connection with their spouse across the disease trajectory. And then the last thing that they did was expressing love and affection. So the spouse with dementia, expressing love and affection was really important. And Frank, whose wife, she actually died right before the interview took place. He talked about how this still occurred for him even at the end of the disease. He said that although his wife could no longer see him or speak, they still expressed their love in their own ways. So this is what he said. I said, "I love you," and she'd automatically smile because she knew my voice. And she couldn't say anything, but that's okay. The smile was worth 1,000 words. So again, if we're thinking about these nonverbal communication, something that can be helpful and was helpful for these caregiving spouses was being able to understand some of the nonverbal signals that their spouse was giving to them. And those were things that were helpful in maintaining their sense of closeness and relationship. Okay, so now we're going to talk a little bit and wrap up with these strategies from caregiving spouses, the things that they did to try to maintain connection and closeness with their spouse who had dementia. And the first one was having open and intimate conversations. These conversations generally happened early on in the disease trajectory. So these happened pretty early, but they were really important in helping them sort of get on the same page about dementia and move forward together. So Eleanor said, our conversations just kind of brought us together. We're all on the same page. So being able to have conversation about dementia was really helpful. Jane said about one of these conversations, she said, it was probably one of the most intimate conversations we've had. It gave us time to cement that closeness we had when we were first together. I could assure him that I would never abandon him. So Jane, her spouse had also passed away right before these interviews. She talked about this conversation that happened quite a long time ago, but she could look back on and remember how much she cared for her spouse and the ways that they had decided to move forward together. So early on in the disease trajectory, these open conversations were really important. Another thing was specifically avoiding confrontation. Now, these caregiving spouses were really strategic about avoiding confrontation. They were particularly aware of when certain behaviors were caused by the disease and not by their spouse. And so they were mindful of, okay, this is something that the disease is doing. I don't need to get upset about it. I can be patient. So here's an example. Annie was talking about her husband. She said, he don't put his pajamas on no more. He sleeps in his clothes. I used to suggest, just put your pajamas on. Hell no. So I let him do that. You know, it ain't no big deal no more. So she's kind of saying, you know what? I can get over it. If you don't want to wear your pajamas, that's fine. Being able to let some things go was really important for these spouses in maintaining a pleasant environment in their relationships and helping them maintain some connection and closeness. Similarly, Bella said, pick your battles. You know, they don't want to shower at a certain time, then wait. And don't fight over things that don't need to be fought over. You just have to be really flexible. So thinking about how to have conversation, one of the things that these spouses did was avoiding confrontation about silly things and focusing on important things for their conversation or their communication with their spouses. Another thing that they did was they were really strategic about avoiding bringing attention to the symptoms of the disease. They wanted to protect their spouses from any embarrassment or shame they might feel, and they didn't want to point out anytime the symptoms of the disease were affecting their ability to communicate or to do other things. So some of the ways they did this, a lot of spouses talked about giving a written report to the doctor so that they didn't have to sit and talk about their spouse in front of them. They wanted to just protect their spouse from that embarrassment. Another thing is some of them talked about that one of the caregiving spouses said that her husband would get really upset by seeing bills. And so she was just really strategic about pulling the bills out of the mail, and he would get all the mail besides the bills, and he could deal with everything else in the mail, and she just took the bills and did them on the side. And so she was pretty strategic about not creating a situation where he wouldn't be frustrated. Another person talked about setting up things that he could do strategically, like that he didn't realize she was setting up for him. So like if something needed to be cleaned that she knew he could do, she would leave that for him. So he did all the vacuuming because he could vacuum, but she knew that she needed to cook, so she'd do all the cooking. So kind of being aware of what are the things that I can do to facilitate their independence. And this happened in the way they communicated with their spouses too. So they were really strategic about not pointing out the symptoms of the disease in their conversations. So here's an example. Kevin said, talking about his wife, he said, every time she says, oh, I can't remember this, or you didn't tell me that, I say, yeah, maybe you're right. Maybe I forgot to tell you. By saying that, I feel much closer to her, much more love. I don't want to create anything that's negative in her mind. And so by doing this kind of avoidance of pointing out the symptoms, these caregiving spouses were protecting their spouses and kind of helping them be able to engage better. Again, we're talking about like this idea of preserving some of independence and some identity, and it also helped them feel closer because they were doing something good for their spouse. Another thing that they did was they found conversations and activities and things that they could engage in together. So this kind of shifted across the disease as their spouse's symptoms got more severe, but they were pretty strategic about finding things that they could do together. So these were things like playing simple games, listening to music together, taking walks, watching movies. At the end of the disease, when things were a little bit more severe, one of my participants talked about we would just sit on a bench and we'd look at whatever we saw and we'd talk about it. So, pointing out the trees or the birds, the sky, just sitting together was something they could share even at the end of the disease. And Robert described these as positive joint experiences that help them maintain companionship. So again, if we think about conversation as caring, taking time to have conversation, finding activities you can do together, all of these things help them maintain closeness and companionship in their marriages. Another thing was finding things that they could laugh about and having a sense of humor. So Garth said, if I can get her to laugh and goof around, she'll laugh and I'll laugh, and maybe we'll get something out of this that can be funny. So again, trying to kind of maintain that sense of humor was important and helpful. And the last strategy that they used was communicating love. You'll notice that they appreciated when their spouse communicated love to them, and they were strategic about communicating love to their spouse, which makes sense in relationships. So some of the ways they did this, one was just saying, I love you. Carol said, we exchange I love you often. It brings us closer when we do that. So just saying I love you was valuable. But they also talked about the ways that they enacted caregiving as a way of showing their spouse that they loved them. And Tom, he talked about these as physical manifestations of care. So these acts of caregiving were actually ways of saying I love you to his wife. So he said, I brush her hair, I cut her nails, and it's a way for me to love her and let her know that she's cared for. So just doing some of these really basic acts of caregiving was a way that he communicated love and was able to maintain that sense of love and companionship for his wife. So that kind of wraps up both the communication recommendations and these specific strategies and relationship changes. I just want to end by sharing one last quote from one of the caregiving spouses I talked to. And I think it kind of summarizes this idea of there's difficult relationship changes, there's some positive relationship changes, and there's specific ways you can communicate to maintain the relationship. And this is what she said. This is from Bella. She said, I say that love wins because dementia will rob the brain, but I believe it doesn't rob the heart. So thank you so much. Any questions?
That's a great quote, Amanda. Thank you. And thank you for sharing all those strategies. One of the questions that I guess I have is that came in was, are there certain things that we should avoid saying when we're working with, when we are communicating with our loved one?
Yeah.
Can you repeat their question?
Yes. So the question was, are there any certain things we should avoid saying when we're working with our loved one? And that's a really good question. One thing that I think is a pretty good recommendation, something that Banner Alzheimer's kind of forwards, they have a little page about it, is not just correcting them or trying to pull them back into your reality. So being patient with their reality. So Banner Alzheimer's refers to this as therapeutic fibbing. I don't know if I love that term because it uses the word fibbing, which feels a little bit like you're lying. But this is things like, so a good example from my own family relationships. When my grandfather had dementia, his wife had passed away a few years earlier. And when he was starting to really be in kind of the throes of dementia, he would always say, well, where's Nedra? Where's Nedra? He was always looking for his wife. And my dad would always say, Dad, Mom is dead. He just kept bringing her back. Mom is dead. Mom is dead, which is a really difficult thing to have to keep hearing over and over again. And so if we're going to use this idea of not dragging them back into reality, then something that could be really important is distracting or just asking questions like I recommended. So one, if they're asking for their spouse, maybe they're looking for like some comfort or companionship. So maybe that's a need that you can kind of infer from that confusion that they're having. So that would be maybe one thing, just recognizing, okay, well, maybe they're confused. So saying, well, mom's not here right now, but I'm here. What do you need? How can I help you? Or maybe it's distracting, saying, well, she's not here right now. She's not going to be back for a long time. So why don't we find something else to do? So kind of distracting and then not just dragging them back. So not saying mom is dead, right? Over and over again is not helpful. Another thing, sometimes it can be confused in ways that might be dangerous for them. So one thing that I've heard some people talk about is like their spouse trying to like get out of the car before they should, or trying to open the car door on their own. In that case, you might need to kind of set some rules that work within their reality. So, okay, well, this door is broken, so you can't open it right now, but I can open it from the outside. So maybe that's using the child lock on your door and then, creating a norm and a rule around that thing without having to drag them back into your own reality. So being able to kind of step into their reality to understand what they're experiencing is helpful, and then distracting them or setting some kind of rule or making some explanation that can kind of help them feel comfortable again. So I would say that's something to avoid. Obviously, if they're really confused and they're going to do something that's dangerous, you need to act in ways that are going to protect them or protect others. But I think as much as possible, if it's not hurting them and it's not hurting you, if they believe that their wife is still alive, that's okay. You don't need to remind them that their wife is dead. You can work with that. So kind of being mindful of, if this is a reality that's not hurting anyone, you don't need to drag them back into reality. So that's one thing I would say would be a thing to avoid.
Great. And I know, we oftentimes hear about folks that get very frustrated when they're communicating with their loved one, like around their medication, right? They have to take their medication. And of course, I think we all think we have to take it right now. And I know that that's been something that we've talked about here at TMC for seniors in some of our classes. Just, you know what, you got to let it go for a little bit and you try again. And, there's a lot of that can sometimes go on, and hopefully you'll get it done when you can, right? As soon as it works. But all you can do is try.
Yeah. I think when we're dealing with someone who has dementia, the thing that we want to think about is, first question, is this harmful to them? So if they don't want to take their medication and they don't have to take it, they just have to take it at some point during the day, they don't have to take it at 9 a.m., then maybe creating some flexibility, like we'll try at 9 and then we'll try again at 10, right? Like we'll make sure you take it today. But if you don't have to fight over it, then don't fight over it, kind of something that those spouses talked about. But then, also, like if it's a harmless confusion, if they're confused about something or they believe something that isn't right and it's not hurting them and it's not hurting you, then I think, allowing them to be where they are, going to that place with them, asking questions, trying to understand. I think also trying to understand what they might be experiencing. So again, with my grandfather who kept looking for his wife, like that's pretty distressing to not be able to find your wife of like 60 plus years. So thinking about, okay, well, he's looking for his wife. Why might he be doing that? Like, what is maybe the underlying need that's making him look for his wife? What might be the challenges if I just keep telling him that she's already dead? Like, that's really hard. So kind of thinking through, how might this impact this person? If it doesn't hurt him to think she's coming back in a while, then allow him to think that, and then distract or do something that will give them something else to focus on.
Thank you. Yeah, the reframing is definitely important. I did want to bring up, you have some research opportunities that you're doing as well. So it looks like you've got some there. Can you just briefly share with our online audience about those?
Let me grab these flyers real quick. Okay. So for the online audience, so here's 2 flyers. They're technically 2 different studies. One is let's see, which hand? This one. One is an online survey. So it's like 20 minutes online. And then I'll send an Amazon gift card to the people who complete it. The other one is an interview. So you would sit down with me in person here in Tucson, or if you want to do it over the phone or over Zoom, and we would talk a little bit more in depth, similar to what I did for the study I talked about. Without the timeline, though, we'd just be talking. So this one also you can get an Amazon gift card for doing. So there's both of these. I think I emailed Jennifer. Okay, perfect. So if you're interested, I think you can get the information via email. But both are great opportunities, and they'll hopefully both feed into more understanding about how can we facilitate relationships with people who have dementia, and also how can we take care of caregivers, what things are important for their health and well-being. So that's kind of the goal of the studies.
Thank you so much, Amanda, for sharing all of that. I know we have so many people who have faced the diagnosis, families that have been affected, and any way that we can help to strengthen those communication strategies, I think, is so important. I don't have any other questions that came in, but I do want to ask. Actually, I do have one more. What can you do if you live across the country from a loved one with dementia?
Oh, that's really hard. Oh, that's a really tough one. I mean, I think as far as communicating with them, you'll have to have some creativity. So I think one thing with people who have dementia is they have a lot of capability for a long time. Sometimes we think about dementia as just the end stages of dementia, but so as much as you can still call them on the phone and talk to them, or using technology like Zoom. I've heard of some people with dementia love that, some people do not like that. So kind of working out what works for your family member. Long distance caregiving or long distance relationships with a person who has dementia is really challenging. So I would suggest kind of as much as you can maintain that connection, whether that's calling them every day or Zooming with them or doing FaceTime, finding ways that you can kind of maintain some connection with them throughout can be really helpful. If you have family members who are closer to them, who are kind of providing care, strategizing with those family members, or if they're in professional care somewhere, strategizing with the nursing home or the nursing facility that they're in. Whatever you can do to kind of help have some ongoing connection would be helpful, I think.
Great. Okay. I do want to just let everybody know if you are interested in other classes that are related to Alzheimer's and dementia or support groups, we do offer the Alzheimer's Caregiver Support Group here through the Alzheimer's Association. So you are welcome to call us and we can provide you the information for that in the office. We also provide the virtual dementia experience so that you can see what it's like to be in the shoes of somebody with dementia. So I would highly recommend that class as well for anyone who may be interested. If you are, please give us a call at 520-324-1960. And Amanda, thank you so much for being here today. You shared some great information. You've got some great flyers all about our communication strategies, which I love. So thank you for sharing all of that with us today. And hopefully we'll hear from you when you've got a new study coming out. So thank you for being here.
Thank you.
Okay, so this is our last class for this week. We do have one more class coming up in December, and that will be Meditation 101, Simple Tools for Peace of Mind. And that's going to be on Wednesday, December 14th at 10 a.m. If you are interested in joining this class, please give us a call. Again, the number is 520-324-1960. It will be offered online as well as in person. Thank you and have a great day.